I guess Dr. Bill Morgan was here earlier, and you're going to see him later on. Again, I guess sometime, but has done a great job at the Capitol. I was instrumental in getting, first of all, things set up at Bethesda, and then to get a chiropractor to come down to the Capitol. And they thought, well, they'd come down one afternoon a week or something like that. Then it was one day a week, and then it was a couple of days a week. And it got to be that he was busier than anyone else down there. And now we have full-time chiropractic care in the United States Capitol for senators and congressmen. And I tell you, he's one of the busiest guys on the Hill. So it just goes to show you, once you introduce it, once people begin to appreciate what chiropractic can do, they come back again and again and again. So we have a good foothold with Dr. Bill Morgan. He's a great doctor, by the way, and he's provided great leadership in the Senate. I just relate one minor story. Actually, I got a speech here I should give, but I had a problem with my shoulder. And I had received chiropractic care for my back and things like that for a long time, but I had a problem with my shoulder. And I went down to the attending physician's office in the Capitol, and they took an x-ray of it, and they were looking at it there, and couldn't figure out what was wrong with my shoulder. It just was really painful. And so the doctor came in, actually Dr. Eisold came in and looked at it, and they looked at the x-rays, and they called Bill Morgan in. Said, Bill, look at this. Do you see anything there? And he goes, I don't know, let me just feel this up. And literally, Dr. Eisold was about from me to that cameraman away from me, and Bill got a hold of my shoulder, and he just did one thing, and there was this loud pop. Actually, Dr. Eisold heard, said, what was that? And he said, oh, he just had something out of place. I said, he mentioned whatever the technical term is for it. I just felt great. I mean, that was it. That was the end of my pain. You know, I didn't require surgery. I didn't require shots. I just required one person who understood the structure, and looking at the x-ray, as he was able to do, he figured out what was wrong with me. I had just pulled something out of place. He popped it back in. I haven't had any problems since. But again, and Bill Morgan did that. And he did it in front of a couple of MDs who were willing to have their eyes open to see that, by gosh, maybe not every MD has every answer to every medical problem in the United States. First, as an Iowan, it comes natural to me to advocate for chiropractic medicine, which I have done for many, many years. As you know, chiropractic was born in Iowa. We're proud of Palmer College, which those of us in Iowa who are biased, consider the world's premier college of chiropractic. The Foundation for Chiropractic Education Research is based in Norwalk, Iowa, which literally is 5 miles from that town of 150 in which I live. Last year, nearly 1 in 4 Iowans visited a chiropractic physician for treatment, and I'm one of them. We believe in chiropractic, and we rely on it. And we feel a sense of duty to spread the word to the rest of America. Certainly, as Dow mentioned, and advocacy for chiropractic has been a consistent theme of mine for well over 2 decades in the Congress and the Senate. In 1992, when I was chairman of the Appropriations Committee that funded NIH, I just wrote a provision in the appropriations bill that established the Office of Alternative Medicine at NIH. The office was charged with promoting alternative and complementary practices, including chiropractic care. The Office of Alternative Medicine started small. I started with $2 million a year. And let me tell you, the higher-ups at NIH saw this as a very bitter pill. They did everything they could to strangle it before it ever got its feet. At that time, I put $2 million in there to start this Office of Alternative Medicine. At that time, the budget of NIH was about $10 billion a year. And to hear the hue and the cry that went up, you would think that I was single-handedly destroying the National Institute of Health with $2 million out of $10 billion. Well, they did everything they could to try to destroy it. For example, as you know, you put up review panels for research reviews that go through NIH. Well, we established the Office of Alternative Medicine, and they only put establishment doctors on the peer review panel. So when a grant application would come in for chiropractic research to be considered, there were no chiropractors on the review panel. Instead, a back surgeon would review the proposal. Well, this went on for a few years. We got very frustrated. So in 1998, After laying the groundwork for a couple, 3 years, I sponsored a bill to elevate the office, to make it not an office of alternative medicine, to make it its own center, the National Center for Complementary and Alternative Medicine, and it was passed, and that's what it's now called. And in changing that from the office and getting it out from underneath the director and making it its own center, we also stipulated that it is required to have at least 50% of their review panel must be made up of practitioners who are expert in the complementary and alternative medicine thus being considered. So in other words, if a proposal comes in for a review, a research project on chiropractic, 50% of the reviewers of that proposal must be chiropractors on that panel. The bottom line, my friends, is that Americans want health care options. They want access to these options and alternatives. Together, we have won important legislative battles in the past, but we have some ahead of us. It is time to give Medicare beneficiaries the freedom to select a doctor of chiropractic as their provider of choice for all of the services that states allow you to perform. After all, beneficiaries who get treatment from a doctor of chiropractic typically cost the Medicare program significantly less. It is also time to fully integrate chiropractic care into the active duty military and veterans health care systems. Despite repeated legislative directives, the military medical bureaucracy is dragging its feet, so we need to keep their feet to the fire. It's also time to commission doctors of chiropractic care to serve in the public as a commissioned officer in the public health service, and I will be shortly sponsoring a bill in the Senate to do that. Now, at the same time, my friends, I need your help on a little bit of a broader legislative agenda, and I think an agenda which is much in line with the thinking and the philosophy of chiropractic. I'm sponsoring comprehensive legislation to shift our health care focus in America. You see, I've often said we don't have a health care system in America, we have a sick care system. All the incentives are if you get sick or disabled or something, then we patch and fix and mend. But there are precious few incentives for maintenance of health, prevention, wellness. That's where we have to focus. To wellness and disease prevention, keeping people out of the hospitals in the first place. Instead of treating people holistically, as you do, and preventing illness and disease, we wait until people get sick and obese and disabled. Then we push all manner of pills, injections, and invasive surgeries to try to restore their health. Someone once defined insanity as doing the same thing over and over again and expecting a different result. Well, our current approach to health care is by that definition, insane. We spend hundreds and hundreds of billions of dollars to pick up the pieces after people get sick. We spend peanuts on prevention. And among other things, we impede many Americans' access to complementary care, to chiropractic care. It's unwise, it's uneconomic, and it's totally unsustainable. If we're ever going to control Medicare and Medicaid costs, and private sector health care costs as well, we need a radical change of course.